There's no doubt about this. Just look at this. The best, precise, tested, expensive, most modern technology is absolutely essential for something like this. Absolutely very, very precise. The smallest error starts, it just gets amplified, it gets multiplied, it dominoes, it results in doom and comes crashing back to the earth. Whereas that was to take someone from one place to the other. And here is skill. Absolutely wonderful skill just going down. And wait a minute. Don't argue that he can't come back up. Just a little bit of thinking, presence of mind, purposeful change of strategy, and he can come back up.
Who is
No
that?
need for technology that brings you crashing down to earth. Sorry, boss. I don't believe that.
Who was that in the tire? You
Wait
or
a minute,
Ram?
wait a minute. Not all of these rocket launches are lost. This one went straight up, then they went and retrieved the astronaut. Okay, they have to bring him back. And ladies and gentlemen, you'll be surprised to know that technology makes a monkey out of you. The astronaut was a monkey. So if you stick to technology, that's what is going to happen. You're going to get converted.
For the science.
Pardon? Oops. Need I say more? I don't think so. But let's quickly look at endoscopic carpal tunnel release. There's a higher risk of conversion. Out of 50 cases, Anil Bhatt has reported this, 40% conversion rate to OCTR. And that's because of the slow learning curve of the idiot surgeon. He's not thinking, he's just using technology. He wants to do it. There is no difference between the two procedures in the long run. So why do you want to push in something and cause a problem? I'm not worried about the learning curve. I can go up and I am trained for rapid descent. There's no problem with the learning curve. Look at this. He's a spinner. He came to me at 8 weeks. I suggested a surgery. He said no, he wanted to go abroad. Latest technology, best surgeon, etc. Came back with this, never spun a ball again in his life, out of the game. Because ideas come. They become encouraging. They become standard treatment. Then they start seeing damaging results. It comes down and falls into disuse. And finally, very old surgeons, like some of them on that side, amaze their juniors with rollicking stories of the old days. That's Scott's parabola. That's where technology is taking you. All this patient needed was skill of doing a very technically nice, simple surgery, putting the hamate in there and getting back good function. Ladies and gentlemen, technological overuse contributes to hyposkilia. It aids and abets disuse, atrophy of cognitive and manual skills. Just imagine technology will fall flat on its face if that company man went out of your operation theater. Half of us wouldn't know what to do next. Technology enables us to do more while understanding less about what we do and makes us dependent on others. Aren't we slaves of conflicts of interest? Aren't we adopting technology to satisfy our egos and say, I do this, and to stay ahead in this rat race? I think so. Let's hark back to the 6th century. Distal radius fractures, Sushruta Samhita. It says the same things that we do today. We've not developed far away. The seeds always fall close to the tree. He was doing traction, manipulation, opposition, stabilization, and immobilization. And if you thought technology helped you to look at CT scans and get 16 or 17 types of fractures, ladies and gentlemen, Sushruta Samhita, 12 different types of fractures. Depressed, complete, comminuted. You just name it. It was there then. It did not need a CT scan. I'm sorry. Yesterday, Dr. Vijay Bhatkar said, technology is a product of human skill. Of course. Still, skill is king. Koi shak?
Fake news.